So good evening. This is the Health and Government Operations Committee. It is 8:10 in the evening. And for those of you that think we don't work, we work, right, guys? And our staff works really hard. So I want to take, if I may have a minute, can we please thank the 3 analysts for their hard work? And we really have, honest to God, I hope I don't offend anyone, but the best. Like, they are so committed and so wonderful. And then I want to also thank our staff, Michelle, Andrea, Marcos, Kat, and we have, who do we have here? Anyone?
Trooper Kim.
The Trooper Kim. All right. And we have Maria, the receptionist. Okay. We have the Vice Chair staff, Brigida. And we have Edith. Okay. So we could not do this work. Jaden, yes, Jaden is good because he keeps my blood pressure low. So I want to say we couldn't do, honestly, this work without them. They're the unsung heroes because you guys don't see them, and this is a lot of work. So these bills have all gone to subcommittee. They've been studied. People have come, whether they're for it or against it. We have read the stuff, and we're just going to vote on them today, okay? So we know these bills. It's just that now we're going to vote on it. But we do have a special visitor today in HGO, and she is welcome anytime. You want to introduce yourself? Come here. Come here. Give us your name.
I'm Madeline Hopwood.
And she's Erin Hopwood's daughter, and thank you for being here. And guess what? She's a future intern for this committee, okay? So she's coming, and we love her because we've known her for many, many years. So we're going to continue with voting list 11 that we had this afternoon, and then we're going to do voting list 12. I'm going to pick up where we left. And in the morning, we're coming back for the floor, and these bills will be on the floor in second reader. So those of you that are presenting them on the floor, please study them tonight. And tomorrow, they'll probably be on second reader and then maybe third reader in the afternoon or something like that. So here it goes. We're going to start with House Bill 850. Delegate Williams, it came out favorable with amendment. It is a procurement bill. And the analyst was Lindsay, and the subcommittee chair, Delegate Kerr. Lindsay.
As introduced, this bill required the Commissioner of Labor and Industry to develop a clear and easy-to-understand graphic data dashboard that includes specified information about workers and wages for ongoing public work contracts. Contractors would have been required to submit specified information to the Commissioner once a week, and the Commissioner to update the data dashboard at least once a month. The amendments that begin on page 16 in packet that's marked C on the front, adopted in subcommittee, strike the bill and establish the work group on the creation of a data dashboard for public work contracts and apprentices to study the most efficient and cost-effective method to create a publicly available data dashboard that disaggregates information regarding public work contracts with the state and make recommendations. The report is due on or before January 7th, 2027.
Thank you. Delegate Kerr.
Oh, this is the old one. Sorry, I got lost. Couldn't find list number.
It's okay.
11.
We have had a long day. Thank you.
Everything's good with this one. I move the amendments.
Second. Okay, wonderful. Are there any questions regarding the amendments? All right. All those in favor say aye. Aye. Any questions or concerns or opposition? Seeing none. Yes. All right. The bill has been moved in second. Any questions or concerns on this bill? Seeing none, all those in favor say aye. Aye. Any opposition? I see none. Who does not want to be on the bill? Okay. So, okay. All right, so all the R's.
Thank you.
Okay, great. House Bill 859, Delegate Solomon. access to health insurance for childcare professionals, favorable with amendment. It came out of subcommittee. The analyst is Lisa, and the Vice Chair Collison handled that subcommittee. Lisa.
As amended, this bill requires the Maryland Health Benefit Exchange to promote access to health insurance for child care professionals by partnering with interested parties, helping child care professionals obtain health insurance through the exchange or Medicaid, assisting child care professionals who lose Medicaid coverage with finding alternative health insurance options, helping insured health plan options meet the budgets and health insurance needs of child care professionals and child care employers, providing informational resources and assessing current levels of health care access across the child care community. The amendments are on page 21. They strike language expanding the definition of qualifying nonprofit organization, require the exchange to promote access to health insurance for child care professionals in partnership with the Department of Education, specify what informational resources will be provided, and require a survey to assess current levels of healthcare access for child care professionals.
Okay. The Vice Chair Collison.
Thank you, Madam Chair. Child care providers are the foundation of our economy. This is giving them access to health care. I move the amendments.
Any questions or concerns? Seeing none, although, oh, I'm sorry. Delegate Kipke.
Vice Chair, where does the money come from for the fund?
The governor put $1 million, I think it was $1.7 million in his budget for child care providers. So $250,000 of that money is now being reallocated to this program.
And this is to pay for nonprofits or something like that?
This is to,
So we're spending $1 million on outreach?
no, 250,000.
All right, what's the rest of the money? I thought you said $1 million.
No, that's going towards
One-
other
one-
things
one-
that child care providers are required. That part I don't know.
Okay, Lisa.
But it's unrelated to the bill?
Correct.
Okay, thank you.
Do we have the answer? Okay, Lisa, can you tell us the answer?
Oh, no.
Okay.
I'm sorry, I thought.
Okay, all right. Any other questions or concerns, Delegate Hutchinson?
It just catches my attention when I see DBM as opposed to a bill. So what's the issue there?
I think it was originally the fiscal note on it, and they worked it out in appropriations.
Thank you.
Any other questions? Were we on the bill or the amendments? Oh, so we're talking about the amendments. Any other questions on the amendments or discussion? All those in favor of the amendments say aye. Aye. Any opposition to the amendments? All right, seeing none. Move the bill as amended. The bill has been moved in second. Any questions or concerns on the bill as amended? Seeing, oh, yes, Delegate Olston.
I'm sorry, I took a look at the fiscal note. Do the amendments correct the fact that DBM said that they're not sure if they're eligible to participate as satellite organization?
The amendment strike that language.
Okay, thank you.
Great question. Okay, any other questions? All those in favor of the bill as amended, say aye. Aye. Any opposition? All the R's. All right. And that's not personal, it just makes it easier. So that I don't have a dream of all the names. Delegate Shalega.
I would just like to say, I too value child care providers, as the subcommittee chair said, but I think this is a lot of money for advertising, and realtors would like them to spend $250,000 to advertise towards them. I just think it's picking winners and losers. Thank you.
You're welcome. Any other comments? All right, so we did the vote already. So let's move on. Excuse me, who does not want to be on the bill? Does not want to be on the bill? All the R's plus Olson. Okay, then. All right. So let's move on to House Bill 1004. It is Delegate Martinez. It's the Public Health, Alzheimer's disease and related dementia information on prevalence and treatment. Came out favorable with amendment. It is Lisa and Vice Chair Collison. Go ahead. Oh, Lisa. Sorry about
1004?
Yeah.
Okay, this bill expands the information that the Maryland Department of Health, in partnership with specified entities, must incorporate into relevant public health outreach programs to include information for healthcare providers on treatments approved by the U.S. Food and Drug Administration for Alzheimer's disease and related dementias, and to increase understanding and awareness of early treatment of Alzheimer's disease-related dementias. MDH, in collaboration with the exchange, must establish and maintain a public accessibility website that includes specified information regarding Alzheimer's disease and related dementia in a downloadable format. There are amendments on page 24 in your packet that starts with a C, or that has a C on it. They require the outreach information to educate healthcare providers on treatments, use, and outcomes, and increase public understanding on the treatments approved by FDA for Alzheimer's disease and related dementias, including relevant information on treatment outcomes based on biological sex. The amendments also require the Department of Health to collect data on the hospitalization rate of Alzheimer's disease and related dementias disaggregated based on co-occurrence of Down syndrome and type of dementia.
Okay. Vice Chair Collison.
The prevalence of Alzheimer's is really terrifying as we, in our culture. So studying it, getting to know how we can address some of the issues related to it is very important, and that's what this bill does. So with that, I move the amendments.
Okay, the amendments have been moved and second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, on the bill as amended. It's been moved and second. Questions or concerns? Delegate Shalega.
Right now,
It's not changed.
what is it?
59,000, and then 40,000, then 22, 21, 21.
Thank you.
So 100,000 plus change?
Over time, about 100,000 and a little change. Okay. Yeah, the cumulative, that's what it is. Delegate Martinez.
Fiscal note, the biggest impact would be just to establish the information on the website, and then the department said that they could do a part-time position, which is why it's like 22, 22, 22, just to continue to maintain it.
Okay, thank you. All right, any other questions? One more. Yes.
Commission on Aging's doing something like this. Do you know that? If that is the case, I mean, are we duplicating efforts?
We're not duplicating, we're complementing. And this is actually.
Good pivot.
This is actually tied more to the Verna Jones Commission and the work that they're doing. So it's really expanding the scope of that commission to look at these issues and coordinate with the Department of Aging and the Department of Health.
Okay, because I do believe the Department of Aging is doing that.
Yeah, they're, like I said, they're complementary.
Delegate Martinez.
And also, Delegate, to your question, what makes this different as well is that we're talking about FDA-approved treatments. There's a lot of breakthroughs that have been made around Alzheimer's care and dementia care, and so we want to make sure that folks here in Maryland have access to that, since we are the leading state in the country for diagnosis.
Any other questions?
Quick question.
Yes, Delegate Kipke.
So practically speaking, is it true that we're going to be putting the latest and most emerging information about this on a website and keeping it updated? Does anything else happen? I asked that question. I'm very supportive of this kind of stuff, but I'm just curious, how will people know about it?
No, that's a great question. So we have really extensive networks through the Alzheimer's Association in the community. They do a lot of outreach. And one of their concerns was that there's not a centralized place for people that are just now experiencing this, trying to get to know information, particularly caretakers of family relatives. And so this would be a resource for individuals in our state to be able to get information initially and be able to navigate this really, really horrible disease.
Thank you. Just a respectful follow-up question.
Yes.
Why isn't the Alzheimer's Association website adequate? Why do we need to do this?
You know, that's a fair question. I think, you know, for me, the reason why I'm doing this is I think having something that our state Department of Health is leading on, I think is something that we could be a reliable source for families in addition to the Alzheimer's Association and the council. And this is a priority from the council.
Okay, thank you.
And we can control it ourselves. Yeah. Delegate Kaiser.
Thank you, Madam Chair. I want to actually follow up on what Delegate Kipke said, because I understood his question as, how will people find out about it? And your answer was why it would be a great resource once they found out about it. So I just want to have you address again, how will they find out about the resource? Because that's, and Delegate Martinez, that question for me is fundamental to just about all the programs we do in government, because we do so many things and we don't always let the group that needs it the most find out about it. So thank you.
Yeah, so the bill doesn't go into how outreach is going to be disseminated, but I think making sure that we hold the department accountable about how they go and outreach and disseminate this information is something that my role on the Council for Alzheimer's Care is all about, right? And so when the speaker appointed me this summer on that council as the House of Delegates representative, part of our role is to make sure that the tools and things that we have out there are being actualized. And so that's something that I'll make sure happens.
Thank you.
Madam Chair?
Yes.
And I think that's part of the charge of this group and of the various groups that we have to determine how best to get the information into the public hands.
Okay. Any other questions? Yes, Delegate, I'm sorry, Delegate Morgan.
Yeah, no problem. Thank you, Madam Chair. So does this bill do something more than I envision in my head, which is an old school page that looks like Yahoo with a bunch of web links on it, taking you to different places? Because that's what I'm picturing this is, and I'm kind of agreeing with one of my colleagues here. I'm kind of wondering, what's the point?
I think the information is the point. The bill doesn't prescribe what the UX design should be and how we should end up, having it interface. I do think we need to update all of our IT to be more user-friendly, and I'll advocate with you on that any day of the week to make sure our resources are more useful to folks in real time. But I think having a place that we can control the information, make sure that it's accurate, is really important.
Look, at this hour and this late in session, I don't want to belabor a point, but I've watched us conduct hearings all session long, and I haven't seen a single person really go to a government site. I've seen a lot of people type stuff into Chat GPT and Perplexity and some other things. So, I mean, I'm just really questioning whether this is needed, period.
Yeah, if I may, this is needed. I was shocked when I looked at the numbers for Maryland, and it is huge and out of control. And a lot of people do not have the information. We get calls in our office of people that do not know where to go and get services when they have a loved one. And I do direct them to different sites. The good thing about this one is that we control it, right? And we're able to bring together and marry all the other programs that we have in government and all the different departments. I have learned a lot lately about the different programs that we have at the state, because I have a little radio show on Monday. I don't know, some of you know, some of you do not know. For the last 18 years, every Monday morning, and I do the radio show, and I choose the topic, and I choose different state agencies, and I go, here is the Department of Labor, and they can help you do a resume. They can help you with counseling. Here is this Department of Energy, and here are these grants. And I think that what a lot of people, going back to the point of Kaiser and Kipke, are not aware of it. But when they do, they use it. And I think that we pass a lot of legislation here, but if people are not aware of it, they can take advantage of it. And I think that every little bit helps. And when it comes to Alzheimer's, like, people just don't know where to go for help, and they're so frustrated. I think every little bit helps. And the numbers, I don't know, Delegate, what's going on, but our numbers are off the chart. And they're getting worse, and they're getting worse in certain communities as well. But I understand your concern, I do. Delegate Shalega.
Sorry, one more bite at the apple.
It's a good apple, tasty,
Yeah.
delicious, right?
I have a family member struggling with this, so
Yeah.
I'm not unsympathetic.
I think we all know it.
To what is going on, but I just want to point out, in just a minute, I got to Alzheimer's Association, quite a great website. And then because I was on the Commission on Aging here for 8 years, the Maryland Department of Aging has a great webpage on Alzheimer's. So I'm going to be voting against this, not because I do not support the effort going on, but we have a $3 billion deficit, and I think we just have to tighten up what we're spending on. Thank
Okay.
you.
Not a problem. So we were on the bill, okay? So, is this bill cross?
Yes.
How, it passed how? 47 to nothing in the Senate? Okay, thank you. All those in favor say aye. Aye. Any opposition to the bill? Delegate Shilega, Delegate Chisholm, Delegate Morgan. Thank you. So let's move on. Where were we? What bill were we on next? Okay, thank you. And thank you for the discussion, everyone. So we have,
Co-sponsor.
oh, who does not want to be on the bill? Delegate Shilega, Delegate Chisholm, Delegate Morgan. All right, thank you. So let's move on then to 1208, Delegate Olston, Public Health Prohibited Ingredients in Food. It came out of the subcommittee favorable with amendment. It was Aaron, the analyst, and Bagnall, the subcommittee chair. Aaron.
There's a reprint of the bill on page 25 of packet C that incorporates amendments that were adopted in subcommittee. The subcommittee amendments strike the provisions of the bill as introduced that would have prohibited a person beginning October 1st, 2025 from selling food that contains red dye number 3 in the state unless the food packaging included a conspicuous warning label that states the food contained red dye number 3. So as amended, the bill provides that beginning October 1st, 2028, a person would be prohibited from manufacturing, selling, delivering, holding, or offering for sale in the state food that contains brominated vegetable oil, potassium bromate, propylparaben, or red dye number 3.
Okay, Delegate Bagnall.
Thank you, Madam Chair. We had a great discussion on this. The elimination of the labeling did take some of the opposition away. However, the retailers remain philosophically opposed because they would prefer that we wait till the federal government takes action. We did learn that they've already taken action on 2 of these 4 items, and the other 2 are in process, and that our timeline aligns with the federal guidance as well. So we felt that it was appropriate to move forward, and it did pass, not unanimously. I would move the amendments.
The amendments have been moved and second. Any discussion on the amendments? See none. All those in favor say aye. Aye. Any opposition to the amendments? See none. On the bill as amended. It's been moved in second. Any questions or discussion on the bill as amended? Seeing none, all those in favor say aye. Aye. Oppose? All right. Who does not want to be on the bill? All right. Thank you so much. House Bill 1292, Delegate Kaiser. It's a health insurance provider directory, require updates. It came out favorable with amendment. Lisa and Vice Chair Collison. Lisa.
This bill replaces the term network directory with the term provider directory to conform with the Federal No Surprises Act. The bill also alters the time period by which a carrier must update the online provider directory after notification from a participating provider of a change in the applicable information from within 15 working days to within 2 working days. The amendments are on page 28 of your packet. They make technical changes and they alter the information required to be included in a provider directory and provide that the requirement to update the carrier's online provider directory within 2 working days does not apply to dental carriers.
Vice Chair.
Folks think this is really, know that this is really important in order to find their physicians in their network, and the amendments passed unanimously and the bill passed unanimously. I move the amendments.
The amendments have been moved in second. Any questions or concerns on the amendments? All those in favor say aye. Aye. Any opposition to the amendments? On the bill as amended. The bill has been moved and second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, who does not want to be on the bill? All right, so let's move on to House Bill 1409. It is actually medical care facilities, electronic monitoring devices. Favorable with amendment, it is Lisa and Rosenberg. Lisa. Excuse me?
It's the chair.
Oh, for myself? Oh, sorry. Oh, I'm sorry.
It's hard to get close to the mic.
We can all hear the chairman.
Are you saying I am a loud island girl?
Respectfully.
It's okay. I know I am. You could take the city out of the girl, not the girl. What is it? You could take the girl out of the city, not the city out of the girl.
As introduced, this bill requires a medical care facility to allow a resident or the legal representative of a resident to monitor the resident through the use of an electronic monitoring device. There are amendments, page 32 of your, actually, that's not accurate because I put a replacement that's in a separate, just 2 pages on your desk for 1409. The amendments make technical changes, and as amended, the bill will codify VERA's law, which currently only applies to nursing homes, and will require the Department of Health to develop guidelines for an assisted living program that elects to use electronic monitoring with the consent of a resident or the legal representatives of the resident. The amendment also provides that the General Assembly intends for the Department of Health to apply VERA's law to assisted living programs, and that's it.
Okay, who is that, Vice Chair? Okay, so is there a motion?
Move the amendments.
So it's been moved in second. Any questions or concerns? Delegate Hill?
So there was discussion, I'd asked a question during the hearing about why
Can you
this
move
vehicle.
closer? Put the.
I'm sorry, about why this vehicle, I mean, the audio recording with permission. I know in the state you have to have two-party consent. What I wanted to know was why this vehicle couldn't be used as the exception, why we couldn't use this vehicle to carve out an exception so that there could have been, when I asked why can't we do it, you said, well, the Maryland law doesn't allow it. But it didn't explain to me why we couldn't make this an exception to Maryland law.
I'm going, you have the answer? Because I'm going to tell you, like I don't know legally, well, the current, that's the law, and it's not allowed. We could change the law.
Right.
But this was not the vehicle to change that law because it will be under the judiciary article. However, let me give you a very simple, respectful answer. The parties would not come on board if it had the audio. This was a compromise, and it was very difficult to even get to where we are.
Okay.
I'm being very, very honest, okay? But thank you for the question. All right. Any other questions or concerns? Delegate Alston.
Thank you. I'm not 100% familiar with VERA's law, but I just wanted to be sure, I think I asked this in the hearing, that both parties have to consent under VERA's law? So the.
My understanding, yes.
Okay, so that, and when I say both, I mean the owners of the assisted living as well as the residents and the multiple residents if they're sharing space?
That's correct.
Okay, thank you.
That's correct. It's not what we wanted, at least I'll speak for myself. It's not what I would want for my loved one, but at least if they have consent, it gives them an opportunity to see things, right? And especially because they're so vulnerable and people tend to abuse them when no one's watching. So it's a compromise. You know, we start here. Can't get the sky, right?
This is also joint with judiciary.
Excuse me?
It's joint with.
It's jointly with judiciary, so we have to send it to them. So this was another good way for us to compromise. I forgot about that part as well. All right, were we on the amendments? Yes. So any other questions or concerns on the amendments? All right, seeing none, all those in favor say aye. Aye. Any opposition to the amendments? On the bill as amended, any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? All right, who does not want to be on the bill? This is a good bill. Thank you, Delegate Warman, you worked really hard. And Lisa, thank you so much, Vice Chair. All right, so we're going to move on to, where were we? 1 second, did I just? What is it called? 1478. Okay, sorry. So Delegate Hill, 1478, Home Health Care Providers Directory. It came out favorable with amendment. Lisa and Vice Chair Cowison. Lisa.
This bill requires the Maryland Department of Health, in consultation with stakeholders, to submit a report to the Senate Finance Committee and the House Health and Government Operations Committee on home healthcare provider directories by December 31st, 2025. The report is required to include information on other states' directories, the type of information appropriate to be in a directory, home healthcare provider directories already established in Maryland, and existing resources and services for programs available through the Healthcare Commission and the Office of Healthcare Quality. These amendments, that's what the bill does as amended, and the amendments are on page 34.
Okay, Vice Chair Collison.
Yes, that was one of the times I was substituting for Chair Rosenberg. And
you were a good substitute.
This was a very popular bill, and the amendments passed, and the bill passed, and I move the amendments.
Second.
Okay, the amendments have been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition to the amendment? Seeing none, on the bill as amended. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, who does not want to be on the bill? All right. Thank you, everyone, for your work. House Bill 1481, Delegate Hill. Disability Services Adopted Vehicle Access Pilot Program established. Favorable with amendment. Aaron and Bagnall. Aaron.
There's a reprint of the bill on page 36 of your packet that incorporates amendments that were adopted in Public Health Subcommittee. The bill establishes the Adapted Vehicle Access Pilot Program in the Maryland Department of Disabilities to provide adapted vehicles to eligible individuals who do not qualify for other programs offered by MDOD that provide access to adapted vehicles. The department must prioritize individuals who reside in areas with limited access to public transportation and solicit donations of vehicles, vehicle modification and adaptive services, and funds from individuals or public or private corporations to implement the program. MDOD may apply for, receive, and spend federal funds and grants for the program. By December 1st, 2028, MDOD must report on the number of recipients of vehicles under the program, how the program has affected recipients' independence, mobility, job opportunities, and dependency on public subsidy, the availability of vehicles, modification, adaptation services, and funds, and a recommendation on whether the program should be extended or expanded. And the program would terminate December 30th, 2030. The amendments would change some definitions that were in the bill. The definition of adapted vehicle means a motor vehicle that has been modified to be operated by an individual who requires a mobility aid. The bill as introduced would have required the individual to need a wheelchair. There's a definition added of donation. That means the voluntary transfer of property, services, or funds to the program or an eligible individual. And then also an eligible individual definition has been amended to mean an individual who requires a mobility aid, is a licensed driver, and is qualified to drive an adapted vehicle. In addition, on line 20, it requires the Department of Disabilities to request, apply for, and facilitate donations instead of the requirement that they solicit donations. And then on bill page 3, there is language after line 14 that provides that in reporting the data that's required, the department must make reasonable efforts to anonymize the data to protect the privacy of recipients.
Okay, Delegate Bagnall.
Thank you, Madam Chair. We had a really lovely discussion about this bill. We all love this bill, and I would move the amendments.
Second.
Okay. Are there any questions or concerns on the amendments? Seeing none, those in favor say aye. Aye. Any opposition? Seeing none, on the bill as amended. Bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Who does not want to be on the bill? Okay, so let's move on to House Bill 1510, thank you. 1510, Delegate Pippi came out favorable. Aaron and Bagnell. Aaron.
The bill requires that a notice about the destruction of a medical record or laboratory or x-ray report be made by both first-class mail and email. Made by first-class mail or email, rather than by both methods.
Okay, all right.
Very tough.
All right, so we moved in second, right? Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, all right. Delegate, House Bill 1544, it is favorable with amendment. Lindsay and Kerr.
We got to shift real quick.
Bye. Have a good night. You're welcome anytime. All right. Oh, Lindsay and you? Okay.
No, 1544 is Kurt.
Oh, 1544, which is Kurt. It's okay. Go ahead. 1 second, guys. It's okay. It's all right. It's been a long day. Give yourself some grace. Go ahead, Lindsay. It's okay.
This bill establishes the Maryland Law Enforcement Public Service Medal as the highest state honor awarded to law enforcement officers for exceptional public service, valor, and heroism. The Department of Public Safety and Correctional Services must establish a medal review committee to evaluate nominations and select medal recipients. There are amendments on page 39 of one of the packets.
I love it. And they have the packet, so they have it in front of them. They have to go and look at it. It's right in front of you.
The amendments add an additional law enforcement officer to be recognized in the preamble and includes a special section provision that the law enforcement officers listed in the preamble receive the medal at the first ceremony that will be held on March 26, 2026. It removes a requirement that a law enforcement agency grant a 1-grade promotion to an employee who receives a medal, and it also changes the maximum number of medals awarded each calendar year to 5.
Okay, any questions? Delegate Kurd.
We did have a late piece of objection come in. It was going to complicate things if we had the promotion or the salary increase in there because of labor agreements. Delegate Bandari agreed to amend it out, so it's ready to go. Move the amendments.
Second. So it's been moved in second. Any questions or concerns on the amendment? Yes, Delegate Chisholm. You're welcome.
I wish I had brought this up in subcommittee, but I don't want the bill to stop. I do think it's odd that we didn't put a road maintenance person in here somewhere. I mean, I know that we're honoring the road maintenance guys that died on that bridge, and there's nowhere in here other than to put their names. So I think I'm just going to bring this up in case, I don't know where Bandari went. Maybe next year he comes back and amends that and maybe adds one of those road maintenance guys to the award somehow.
Can we move it in conceptually?
So just to be clear, what is it that you'd like to, how would you like to honor them? Like in the preamble, do you want to do something different?
Like one of either the Department of Transport, one of the road maintenance guys to be added. I don't want to gum up the bill because I think it's an important bill right now, but maybe, I don't know, next year, because I don't know how to tell you how to nominate it, but I think that we're missing something by not having.
So why don't we do something next year? Let's introduce the bill next year, okay?
Okay.
And thank you for the courtesy.
Yes, thank you.
Appreciate it. Delegate Hill.
Madam Chair, so I had asked about the pilots, and Delegate Bandera was very open. He called me last night. We started talking about it. We were on a time crunch, but I also found out something, so I want to be clear. The pilots who did try to redirect, called the SOS, are the ones responsible for it not being a worse disaster, but they're also not named because since they're driving the boat, there was too much concern that people would blame them for it. So I think it makes sense that we're not bending over backwards to include the pilots. But I just want to make sure we all know that they also play a really important role, not just in this disaster, but in keeping us from having other disasters as people navigate into our ports.
Can we do that together next year? Is it okay?
Even if it was just a word to honor the pilots or to mention them or the road workers, but it's okay. We can do that something next year. Everyone's been on the floor, right? We've honored different people on the floor, and this was an opportunity I just needed to publicly make sure that their names, that their existence was acknowledged.
So Lindsay would, go ahead, Lindsay.
Well, I just also wanted to comment that it does say that the ceremony shall annually honor and remember the sacrifices and contributions of the following workers who lost their lives in the Francis Scott Key Bridge collapse. So if you're looking at page 4, lines 17 through 22, it lists these gentlemen. One would hope that there aren't regularly road workers who are losing their lives. Like the medal is otherwise looking at law enforcement officers who are risking their lives or putting their lives on the line. These gentlemen, had an exceptional circumstance and they lost their lives, and they're going to be regularly honored with these the medals that are honored.
Well, Lindsay points that out, but I'm wondering just conceptually, if we could say that and saying shall also just honor the work that is done daily by the pilots and the road maintenance people without naming them specifically. There's an annual ceremony.
Will you be okay if we were to put like a sentence that will reference to both categories? Can we do that conceptually? Somewhere in the preamble?
Or somewhere where we're talking about the annual ceremony?
So again, if you're looking at the bill on page 4, I don't know where in the packet, I apologize, but the reprint of the bill should be somewhere in the packet. So page 4 of the reprint, right now it says the ceremony shall annually honor and remember the sacrifices and contributions of the following workers who lost their lives in the Francis Scott Key Bridge collapse. Lists those workers. You could say, and other workers who put their lives on the line.
Or to honor the road workers, the pilots, and the other people who continue to keep our ports functioning and open, something like that?
I think we can do it without whoever does that ceremony, I'm sure we can get a hold of them and ask them just to put that sentence.
But we can do it now, and we could do, Delegate Olston, we could fix it with one sentence. 1 second, 1 minute, please. We'll figure it out. No, but I like that. And thank you for being flexible. Delegate Olston.
Thank you. Actually, to Delegate Chisholm's point, I think we can fix it now. And I think that we should have one of those awards going to one of the, like, it could be Department of Transportation or highway worker, but those are the people that actually lost their lives trying to fix our roads and keep our roads safe. So we are definitely in agreement with honoring the law enforcement, but I think we need to honor those people as well, because I think those are the... So how will you fix it?
Just give me a sentence.
I just said, I texted to you.
Okay, you text it to me?
Let me, yes, it says,
I'm sorry.
An individual member of the Department of Transportation or road maintenance work crew.
We had that bill this year where they wanted to be first responders. It would be really bad to ignore them in this one too. But that doesn't mean in the section where Lindsay's talking about that we can't say, in addition, there should also be an award to an Department of Transportation person, and there should also be one, a pilot should also be honored that day. We don't have to list who was there. We can just say that we acknowledge that they should also be acknowledged at the ceremony. That every year, someone nominated by the head of the department.
Hold on, delegate. If we cannot figure it out, then you're gonna have to put in a bill next year. Okay, so let's try to figure it out. 1 second, 1 minute. Okay, give Lindsay a second to help us, okay? 1 minute.
Well,
Delegate.
Can I interject also that right now the bill has a medal review committee being established in the Department of Public Safety and Correctional Services. So presumably you would also need some sort of committee that exists in MDOT to look at their workers. So, yeah.
Well, the bill's not ready then, because we can't figure it out. Delegate Gazzoni.
I was essentially going to say sort of what Lindsay just said. Even the purpose of the bill is to establish the Maryland Law Enforcement Public Service Medal. So I'm not raining on anybody's parade, but I think this is a good bill. If we want to do something additional next year, I think that's fine and well and good and honorable. But I think it's, I guess my point is I'm not sure that this is an easy one-sentence fix.
So I tell you what, because it's so late, let's get it through. If you think about something in the Senate, I give you my word, what committee does it go to? I don't even know. I think it's either Finance or Triple E. That I will call them. They're really great to work with. I know Senator Penn Bidel and Senator Feldman, and I will say we had time, the clock on top of us, but here's a suggestion. Can you add this? Is that okay? And can I do something? Can I create a little subcommittee? You, Chisholm, and Alston, can you try to figure it out? Thank you so much. Thank you very much. Okay, all right? It's okay. Thank you for the discussion and the thoughtfulness. All right, so was I on what? Was it an amendment? That was an amendment. Okay, so bill has been moved as amended. Oh, any questions or concerns? All right, all those in favor say aye. Aye. Any opposition? Seeing none. So then the subcommittee, when we're done here, please talk for a minute. If you could figure it out, let us know, okay? Co-sponsors, anyone doesn't want to be on the bill? Okay. Yes.
Everyone wants to.
Okay. Okay, so let's.
Chair, before we go on.
Yes.
I apologize. I missed something.
Thank you, Dr. Golson.
On House Bill 1292, I'm wondering, I know we passed it and we still want to pass it, but there's a technical problem with it because we've named dental organizations and sent.
She already fixed
it?
that.
Oh.
Okay.
Never mind. Thank you very much, Lisa.
Okay. All right, so can we go now? We are now moving to voting list number 12. The withdrawal have been moved by Delegate Woods. It's been seconded by Kipke. All those in favor say aye. Aye. Any opposition? Seeing none, let's move on to the first bill. We're almost done, guys. House Bill 333, Delegate Kurd, cybersecurity, favorable with amendment, Lindsay and Kurd. Lindsay.
As introduced, this bill established new responsibilities relating to the cybersecurity of healthcare ecosystems, including staffing, reporting, auditing, and the establishment of a work group for healthcare ecosystem entities. The amendments for this bill are on page 1 of the packet that starts with House Bill 333 reprint on the first page. The amendments strike much of the bill, and rather than requiring MDEM to convene a stakeholder work group, establishes a healthcare ecosystem stakeholder cybersecurity work group staffed by MHCC and MIA, tasked with developing strategies to prevent cybersecurity disruptions to the healthcare ecosystem services, ensuring the continuous delivery of essential healthcare ecosystem services, and enhancing recovery efforts of the healthcare ecosystem following a cybersecurity incident. The work group must submit an interim report on or before January 1st, 2026, and a final report on or before December 1st, 2026. And let's see if I've got the page reference for you guys. There was discussion in subcommittee about the membership of the work group. So on page 15 in your packet, sort of a little above halfway, the subcommittee added one representative of the Maryland Hospital Association to the work group.
Okay, Delegate Kerr.
Thank you, Madam Chair. We really don't need to talk about this bill anymore. I move the amendments.
The amendments have been moved in second. All those in favor say aye. Aye. Any opposition on the bill as amended? The bill has been moved in second. All those in favor, any questions or concerns? All those in favor say aye. Aye. Any opposition? All right. Who does not want to be on the bill? Okay. Delegate House Bill 535, Delegate Simmons. Oh, who does not want to be on the bill? Everybody wants to be on it. Okay. House Bill 535, Delegate Simmons. Abandoned and neglected cemeteries found favorable with amendment. It is Lindsay and Rosenberg. Lindsay.
As originally introduced, this bill established the Abandoned and Neglected Cemeteries Fund and the Abandoned and Neglected Cemeteries Fund checkoff on the individual income tax return form. The purpose of the fund is to provide for the care, preservation, maintenance, and restoration of abandoned and neglected cemeteries in the state. The amendments that, so what you have in your packet, beginning on page 18, is the copy of the third reader version of the Senate bill. The amendments will conform the bill to that Senate cross-file. The amendments strike provisions relating to an income tax checkoff and authorize the governor to include in the annual budget bill an appropriation of $250,000 to the fund. The Senate cross-file passed the Senate 47-0, and this bill is jointly assigned with Ways and Means.
Okay, so Delegate Rosenberg, right?
Rosenberg. In terms of the amendments that conform it to the Senate bill, there were concerns that adding another entity to the checkoff would diminish the checkoff and use of the checkoff in general. And then there was also the necessity of conforming to the Senate bill to avoid a conference committee. So I would move the amendments.
Second. It's been moved in second. Any questions or concerns on the amendments? Seeing none, all those in favor say aye. Aye. Any opposition on the amendments, on the bill? It's been moved in second as amended. Any questions or concerns? All those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Who does not want to be on this bill? Okay. House Bill 830, Delegate Dana Jones, Health Insurance, Genetic Testing, and Cancer Imaging. It came out favorable with amendment. It is Lisa and Vice Chair Collison. Lisa.
This bill requires carriers to provide coverage for genetic testing to identify whether an individual with a personal or family history of cancer has an inherited mutation associated with an increased risk of cancer. Carriers must also cover follow-up evidence-based cancer imaging if the genetic testing determines the individual to be at an increased risk of developing cancer. There are amendments on page 40 in the new packet that we're using, and they strike the provisions in the bill that would have prohibited cost sharing.
Okay, Vice Chair Collison.
Thank you, Madam Chair. This was a tough bill because it's significant in that we are getting genetic testing that helps to diagnose and treat these to treat cancer, but we have to be sensitive to the impact on premiums. So the compromise bill was to mandate without prior authorization the test when they are recommended by the physician, but the cost sharing, the copay or coinsurance would continue. So with that, I would recommend. I would move the amendments.
It's been moved in second. Any questions or concerns? Seeing all those in favor say aye.
Aye.
Any opposition on the bill as amended? The bill has been moved in second. Any questions or concerns on the bill as amended? Seeing none, all those in favor say aye.
Aye.
Opposition? Who does not want to be on the bill? Okay. Let's move on to the next bill, House Bill 838, Health Occupations Licensed Direct Entry Midwives Revisions. Favorable with amendment, it is Lindsay and Rosenberg. Lindsay.
This bill specifies that, as introduced, specified that except for specified transfers or consultations, the practice of direct entry midwifery is independent and does not require oversight by another healthcare practitioner. The scope of practice, direct entry midwifery, and the medical conditions under which a licensed direct entry midwife must consult or transfer the care of a patient are altered. The bill also repealed a reporting requirement, altered the requirements for specified written plans and procedures for hospital transfer, clarified the actions of the State Board of Nursing may take if an applicant to practice direct entry midwifery or a licensed direct entry midwife violates the grounds for discipline, extends the termination date of the provisions governing direct entry midwives by 5 years to July 1st, 2030, and makes stylistic and conforming changes. The amendments that begin on page 25 of your packet in a reprint retain that the practice of direct entry midwifery includes notifying a pediatric healthcare practitioner within 24 hours after delivery, strikes language that referenced required transfers and consultation in relation to the independent practice of direct entry midwifery, alters the list of conditions requiring transfer, consult, and immediate emergency transfer. Specifically, the strikes from the list of conditions requiring transfer to a healthcare practitioner RH sensitization with positive antibody titer, restores significant fetal congenital anomaly, but requires that it must directly impact The birthing process will require immediate emergency care as determined by the board and regulations, and restores severe anemia, meaning less than 10, and clarifies that it must be either measured after treatment or based on blood tests performed at 56 weeks or later. Clarifies that consult for active genital herpes lesions is only except where transfer is required, and requires immediate emergency transfer to a hospital if congenital anomalies are significant rather than life-threatening and directly affect delivery or immediate postpartum care or require immediate emergency care as determined by the board and regulations. The amendments restore the requirement that a licensed direct entry midwife plan identify the pediatric healthcare practitioner who will be notified after delivery to receive transfer of care of the newborn. Requires the licensed direct entry midwife accompany the patient to the hospital only if it's determined appropriate by the licensed direct entry midwife and the receiving healthcare provider. Requires the licensed direct entry midwife to provide records as determined by the board and regulations, and establishes that the licensed direct entry midwives shall be subject to reporting requirements adopted by the board and regulations in consultation with the advisory committee and other stakeholders.
Delegate.
The compromise amendments worked out by the sponsor of the bill led to a unanimous decision. Move the amendments. Second.
Okay, so the amendments have been moved and second. Any questions or concerns on it? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, on the bill as amended. Any question or concerns on the bill as amended? Seeing none, all those in favor say aye. Aye. Any opposition? Opposition? Okay. Delegate Kaiser. And that is House Bill 830? Okay. 838. Okay, 838. All right. Who does not want to be on the bill? Delegate Kaiser, Delegate Shalega. Okay, wait, hold on a second. Can you do me one favor? Raise your hand if you do not want to be on this bill. Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, okay? And Delegate Kaiser.
Hutchinson, you had your hand up before, no?
No. Okay?
Okay, wait, sorry.
It's okay. And Kaiser, okay? Okay. All right, so let's move on to the next bill, which is House Bill 1087, correct? 1007. And it came out favorable with amendment. It is Lisa and Collison. Lisa.
This bill prohibits an insurer that offers, issues, or delivers a life insurance or disability insurance policy or contract in the state from taking specified adverse actions related to genetic testing against an applicant or insured. The amendments are on page 41 of your packet. They strike references to long-term care insurance from the bill. This is a little bit different than what we talked about in subcommittee today. Originally, MIA had brought up that long-term care insurance, there was a conflict with existing law, and we thought we were only going to have to remove one provision, but they advised us that we should remove long-term care from the provisions of the bill. So it now just applies to disability and life insurance. Okay, so the amendments also specify that carriers may not unfairly discriminate against an individual by taking certain actions related to coverage based on medical information, including the results of a genetic test for which there is not a relationship between the medical information and the cost of the insurance risk. They prohibit carriers from accessing sensitive medical information without consent, and prohibit carriers from mandating genetic testing or full genome sequencing as a prerequisite for life insurance or disability insurance eligibility or coverage.
Vice Chair Collison.
Thank you, Madam Chair. So this was another compromise bill, and in order to, so what it ends up doing is carefully describing how life insurance and disability insurance carriers can use the information with written consent of the individual in calculating the risk for the policy. So there's some, and it also prohibits, as Lisa said, the requirement for any genetic testing. So this again was based on a program, or based on a legislation that was done in Vermont around these same issues. They've been operating now for about 5 years in Vermont, and it hasn't been a problem. And in fact, the advocates who were working for our original bill were part of the discussion in in Vermont when that legislation was passed. So with all of that and all of the work on it, it passed unanimously, both the amendments and the bill. So I move the amendments.
Okay, I'll talk to you in a minute. Sorry, I'm trying to multitask. So,
I moved the amendments.
okay,
and
the
they were
amendments have been
seconded.
moved. It's been second. Any questions or concerns? Delegate Olson?
I can wait for the bill. I
Okay,
can wait for my question for the bill. We can dispense with it.
okay. All those in favor say aye.
Aye.
Any opposition? Seeing none, on the bill as amended.
Thank you, Madam.
It's been moved in second. Now we're opening up for questions. Delegate Olson.
Thank you, Madam Chair. I actually like the bill. I was a little confused about why we took the long-term care piece out. And when you mentioned Vermont, I'm wondering, do they have the long-term care piece in their bill?
I believe that they do, but in current statute right now, they are prohibited from using genetic testing in our current standards for long-term care. So MIA said there was a conflict in the law and we couldn't resolve it that quickly.
So they currently can't use genetic testing when making the determination on long-term care?
On long-term care, yes.
Okay, all right, thank you.
Okay, any other questions? Any questions? Okay. The bill has been moved in second. We addressed the questions. All those in favor say aye. Aye. Any opposition? Seeing none, who does not want to be on the bill? Okay, so let's move on to House Bill 1310. No, 1087. Favor with amendment, it is Lisa and Collison.
This bill prohibits carriers from imposing a step therapy or fail-first protocol for a prescription drug approved by the FDA that is used to treat a symptom or side effect of stage 4 advanced metastatic cancer. There are amendments on page 43 that provide that the drug must be prescribed by a treating physician and covered under the terms of the policy or contract.
Vice Chair Collison.
Thank you, Madam Chair. This is a really good bill, and it passed unanimously in subcommittee, so I'd move the amendments.
The amendments have been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition on the bill as amended? Zero, all right, I know we're tired, and we're trying to multitask. I don't think people understand unless they're in your shoes, right? So we did move the amendments, right? All those in favor say aye. Aye. Any opposition? Okay. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Who does not want to be on the bill? Okay. Let's move on to 1310. Do I have that right? Yes. It came out favorable. It is Lisa and Collison. Lisa.
This bill authorizes a pharmacy licensed in another state to participate in the prescription drug repository program.
It's been moved
There are
in
no
second.
amendments.
Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, let's move on to 1315. Favor with amendment. Lisa and by. Okay. We are now on 1315. Yeah, but 1310 I voted against. Okay, you want to be consistent? So let's go back to 1310. I'm sorry. Who does not, I'm sorry, who does not want to be on the bill?
She also doesn't, she wants to vote against 1310.
I want to vote against and not be on the bill. It's faith, so we can have.
It's voting against the bill. Oh, so she's voting against the bill. Who's voting against the bill? Hold on a second, guys. I can't hear because you're all talking. Thank you. All right, what is it?
House Bill 1310, I'm voting no because it hires another state employee. Thank you.
Okay, is that clear for the record? Okay. All right, let's move on now. Where was I? 1315. All right, it is favor with amendment. It is Lisa and Collison. Lisa.
This bill requires specified insurance policies and nonprofit health service plans to include in their minimum package of child wellness services required under current law all visits for and costs of childhood and adolescent immunizations recommended by the Center for Disease Control and Prevention's Advisory Committee on Immunization Practice on December 31st, 2024, or at a later date to account for new recommendations. There are amendments on page 44 that specify that pharmacists' authority to administer vaccinations is based on the recommendations of the CDC's ACIP recommendations in effect on December 31st, 2024, or a later date to account for new recommendations, and similarly provide that the coverage requirements for childhood or adolescent immunizations are also based on the ACIP recommendations.
Vice Chair Collison, and I'm going to go slower now. Vice Chair Collison.
Thank you, Madam Chair. This is about making sure that in the future, we are able to provide these immunizations and at the convenience of a pharmacy. So the amendments were unanimous, so I move the amendments.
The amendments have been moved and second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. There's questions. Delegate Riley.
I was just
It's
wondering,
okay.
thank you, Madam Chair. It says the physical note is 0 now, right? But I have one here that it's adding to Medicaid funds would increase. How would that affect?
If federal Medicaid funds are decreased, then our state portion would increase. I think is why it says it may increase.
Gotcha.
Okay.
Thank you.
So were we on the amendment? Okay. Any questions or concerns? None. So all those in favor say aye. Aye. Any opposition on the amendments, on the bill as amended? Move the bill as amended. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Delegate Morgan. All the R's to make it easy. All right.
Co-sponsor.
You don't want to co-sponsor? You guys, I'm confused enough, okay? So who doesn't want to be on the bill? All the R's, okay. The R's did not vote and the R's did not want to be on the bill. How's that for clarity? All right. All right, let's go to 1351, favorable with amendment. Lisa and Collison.
As introduced, this bill requires carriers to complete applications by certain behavioral health providers to participate on their provider panel within 30 days after receipt of a completed application. The carrier must accept or reject the provider for participation on the carrier's provider panel and send written notice of the acceptance or rejection at the address listed in the application. There are amendments on page 49 that limit the practitioners the bill applies to and require completion of the credentialing within 60 days rather than 30 days of receiving a completed application.
Okay, Delegate Vice Chair Collison.
Thank you, Madam Chair. First of all, I want to thank Delegate Hutchinson for taking the lead on this and coming to a compromise that everyone liked. It wasn't just living with, everyone actually liked it. So I would move the amendments.
Second. The amendments have been moved and second. Any questions or concerns on the amendments? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none on the bill. It's been moved in second as amended. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, who does not want to be on the bill? Okay. House Bill 1355, Delegate Riley came out favorable. It is Lisa and Vice Chair Collison. Lisa.
Second.
It's been moved in second. Any questions or concerns on this bill? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, House Bill 1473 came out favorable with amendment. It is Lindsay and Kurt. Lindsay.
This bill expands existing requirements for specified state departments, agencies, and programs regarding efforts to provide equal access to public services for individuals with limited English proficiency. Among other requirements, the entities must develop a language access plan, take reasonable steps to provide equal access to public services for individuals who need language assistance based on be in language, limited English proficiency or a disability, and arrange for the translation of vital documents as specified. By September 30th each year, the state entity identified by the bill must submit a report to the Governor's Office of Immigrant Affairs that contains certain information for the previous fiscal year, and the office must generally monitor and enforce compliance with the bill's provisions as specified. There are amendments on page 50 and 51 of your packet that strikes the mandated $400,000 appropriation to the Governor's Office of Immigrant Affairs and restores the existing percentage under current law of 3% for the limited English proficient population for which vital documents must be translated.
Thank you, Lindsay, and I know this took a little bit of work, so thank you for your work. Delegate Kerr.
Thank you, Madam Chair. We started this afternoon and we finished this evening.
I know, thank
We
you.
worked out all the issues. It was not unanimous in subcommittee. I
Okay.
move the amendment.
All right, so the amendments have been moved and second. Any questions or concerns on the amendments? All those in favor say aye. Aye. Any opposition on the bill as amended? I'm sorry, I did not see you. I apologize. Delegate Shalega.
You're on the amendments, I'm fine with the
Yeah,
amendments.
you're fine? It's okay. I know it's okay. Not a problem. On the amendment, all those in favor say aye. Aye. Any opposition on the bill as amended? It's been moved in second, now we're open for discussion. Delegate Shalega.
Thank you. While the fiscal note's been struck, this bill, as it's written, requires quite a few state workers to implement it. So staying consistent with my concern for our $3 billion deficit, I'm voting against it. Thank you.
Thank you. Delegate Martinez.
Thank you, Madam Chair. As chair of the Latino caucus here in the legislature, I just am really appreciative of the committee's work on this. This is a priority bill for us, and I look forward to voting for it. Thank you.
Thank you. Oh, thank you, Lindsay. Delegate Bandari.
I would second what Delegate Martinez says.
Okay, thank you. Anyone else? All right. Delegate Chisholm, okay.
What we learned in the hearing, and
What is it?
Mr. Chairman can correct me if I'm incorrect, all of this stuff is already in law. This just would give them the ability to actually bring probably legal suit and for people that are not living up to the law, from what I understand. If I'm incorrect on that, you can correct me, but that's what I took from that bill hearing. I asked why we needed the bill. They said, well, it's already codified in law, but there's no mechanism to enforce through legal means, I guess, or to bring what I took to believe would be a lawsuit.
Okay. I can hear you, Delegate Kirk. Can you put your microphone?
I said,
Okay.
yeah, it wouldn't be criminal. It would be a civil action, but
Yeah,
he's corrected. It provides an enforcement mechanism.
right. Okay, thank you. Thank you, Delegate Chisholm. Thank you, Delegate Shalega. Delegate Bagnall.
Thank you, Madam Chair. And,
you're welcome.
And thank you for the courtesy, because I'm not on this subcommittee, but as I recall from the hearing, and I think I've spoken with some of the advocates in the past, this is also addressing a concern for the DDA community that when you have people that are navigating that system and English is not their first language, that it adds an additional layer of complexity. So would this relieve some of that barrier in navigating the systems?
Apply to people who are unsighted or deaf.
Thank you. And also navigating like 504s and IEPs and things of that nature.
Yeah, anyone who needs assistance with
Just need an answer.
language other than written or English.
Okay, thank you very much.
All right, so we have Delegate Kipke.
Thank you, Madam Chairman. So I voted for this, not thinking that it created a civil right of private action. And I'm not sure that it actually does. I'm told that on page 7, There is a place in here that does that, but what I see is in line 15 and 16, the process for filing a complaint related to a language assistance service. That, am I wrong? I don't think that's providing a right to private.
I don't think it provides a private right of action.
Okay.
May I, Lindsay?
Yeah, that's right. The language access plan that each department or agency or program is creating has to have a process for filing a complaint that's related to language assistance service. And then the Office of Immigrant Affairs is collecting all of the information from the agencies, and that includes the number of language access complaints received, the current status of the complaints, and the steps taken to resolve the complaints. So that would be part of the reporting.
Okay. Thank you.
Thank you, Delegate Kipke, and thank you, Lindsay. That's great. Thank you for clarifying the record. Delegate Taveras.
I just want to say again, as one of the people who started this in my own jurisdiction, and we weren't able to include enforcement, this legislation is so incredibly critical for the people who we serve, who need access, need services, and are in need through another language other than English. We, at the end of the day, especially now, they need to know that they have the same rights and access to the services we provide, period. And this is a mechanism. And the thing is that it costs so low because we already have staff in these places that can provide these services now. So the fiscal note works. So I think that that's the reason why we should vote for this. Thank you.
Okay. Thank you. Well,
And you voted on the amendments already. You're on the bill.
any other questions? All right. All those in favor say aye. Aye. Any opposition? Delegate Shalega, Delegate Chisholm, Delegate Morgan, and Delegate Riley. Okay, thank you so much for the discussion, okay? Who does not want to be on the bill? Delegate Shalega, Delegate Chisholm, Delegate Morgan, oh, the R's, okay. Okay, thank you. You can see where I am a little tired. I apologize, guys. We are going to, I'm sorry, it's been a long day for all of us. House Bill 1474. It is favor with amendment. It is Lisa and Rosenberg. Lisa.
This bill authorizes an out-of-state licensed professional counselor to provide clinical professional counseling services through telehealth to an out-of-state student attending an institution of higher education in the state. This authorization does not apply to a student who establishes residency in the state or is enrolled in a health insurance benefit plan in the state that restricts coverage to in-state healthcare providers. The amendments are on page 52 of your packet. They clarify that the counselor must be in good standing with the regulatory authority in the other state. They require the counselor to notify the board that they will be providing the telehealth services and provide the board with their contact and licensing information and any changes in this information. They strike language that would have limited the amount of services that could be provided under the bill. They require that the student-counselor relationship have existed for at least 6 months before the counselor may provide telehealth services in accordance with the bill. And they strike provisions that would have terminated the bill if the state entered the Interstate Licensed Professional Counselors Compact and instead sunset the bill in 3 years.
Delegate Rosenberg.
It was unanimous after these amendments, which conform it to other areas of state law regarding telehealth. Move favorable.
It's been moved. Thank you. All right. Any questions or concerns on the amendments? Seeing none, all those in favor say aye. Aye. Any opposition on the bill as amended? The bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, who does not want to be on the bill? All right. Let's move on to House Bill 1499. We have one more to go, guys. 1499, favorable with amendment, Lindsay and Kerr. Lindsay.
As introduced, this bill requires that state procurement contracts for construction and contracts for any kind of service include a clause that requires contract modification for the equitable adjustment of a contract for increased costs for compensation and benefits as a result of statutory changes increasing required compensation or benefits or for collective bargaining. The amendments on page 54 of your packet make the required clause for construction contracts applicable to a contract that is for 3 years or more in duration and valued at greater than $1 million, limits the required clause for services contracts to contracts for security services that are for 3 years or more and valued at greater than $1 million, specifies that a contract modified under the bill is contingent on approval by BPW and delays the effective date, to 2026.
But Delegate Kerr.
Committee, it ended up, we adopted the amendments, but the bill did not move unanimously through subcommittee. But let me go ahead and move the amendments.
The amendments have been moved in second. Is there discussion or concerns on the amendments? I cannot see your, okay, all right. All those in favor say aye. Aye. Any opposition on the amendment? See none on the bill as amended. It's been moved in second. Questions or concerns, Delegate Kipke?
Thank you, Madam Chairman. I voted against it in subcommittee, but I'm going to vote for it here because I got additional information that resolved my concerns. Thank you.
Thank you, Delegate Kipke. Okay, thank you. Beautiful. So all those in favor say aye. Aye. Any opposition? Who does not want to be on the bill? All right, and the last bill. All right, and then we could go.
Wants to be on the bill?
Yeah, everyone wants to be on it. So the last bill is House Bill 1555. I want us to go through this bill slowly, gently, and understand what we're doing here. I know we're tired. Hold on. All right, we're tired and some of us are cranky. So let's just move on with it. Okay, I'll speak for myself. House Bill 1555, funeral establishment, crematories, right? It is favorable with amendment. It is Lindsay and Rosenberg. Lindsay, go ahead.
So as introduced, the bill requires the Office of Cemetery Oversight and the State Board of Morticians and Funeral Directors to adopt regulations that, I'm not even going to say that, that part's out. The office and the board must each conduct at least 2 unannounced inspections annually of the facilities they regulate, employ at least 1 inspector, establish and maintain a public online database with information, make specified notifications, and submit and publish a specified online annual report. If the office or board finds that a person has violated statutory requirements with gross negligence, improperly handled human remains, or repeatedly violated specified statutory requirements, the person is subject to a civil penalty, permanent revocation of licensure, and referral for criminal prosecution. You have a separate packet with a reprint of this bill as it came out of Health Occupation Subcommittee. The amendments make the bill an emergency bill. For both the office and the board, strikes the requirement to adopt regulations on refrigeration. That's the part I just didn't say at the beginning. Requires twice yearly unannounced inspections by a trained staff member rather than the director or the board. For the Office of Cemetery Oversight, that's only for operators that have been reprimanded within the immediately preceding 5 years, and for the board, for facilities that are under probation. Strikes the requirement for inspection within 30 days after sanitation violation, strikes language regarding inspection staffing, strikes the requirement that the database include complaints, and also adopted in subcommittee is that the language regarding violation was changed to the post information regarding each disciplinary action taken by the board or the office as appropriate. Let's see, strikes the annual report requirement to the General Assembly. Then for the board only, not the Office of Cemetery Oversight, the amendments require the governor to designate the board president, expand options for the governor to remove appointed members of the board, establishes quorum requirements and requirements on the number of members required to take a vote on certain actions, authorizes the executive director to direct immediate investigation of certain complaints and requires those complaints to be presented to the board for review at the next scheduled meeting of the board, authorizes disciplinary action for the improper handling of human remains or failing to get permission or a court order before embalming or artificially preserving, rather than and those two. Authorizes the executive director to direct a board liaison to prepare charges rather than referring the case to the Office of the Attorney General for a prosecutor to prepare charges. Authorizes the Secretary of Health to employ staff for the board designate the executive director and set compensation for the board, removes the prohibition against other state money being used to support the Board of Morticians and Funeral Directors Fund. Those two provisions, the staffing and the fund provisions, sunset after 3 years. And the subcommittee also changed the penalty authorized under the bill from $50,000 to $25,000.
I want to start by saying thank you to Lindsay for working so hard on that bill. There was so much and so many people, so many opinions. And thank you for sorting it out with the group. I also want to thank publicly the subgroup that worked on it, which, please correct me if I leave someone out. I'm just a little tired. Delegate Hutchinson, Delegate Shalega, Delegate Semple Hughes, Delegate Bandari, Delegate Kerr. Anyone else? Did I forget anyone else? Okay. I want to thank you publicly for all the work on this. Delegate Kerr, why don't you go ahead? I'm sorry. Who was it? Rosenberg. Sorry. Go ahead and address it.
Well, with all that hard work, the bill passed unanimously.
All right. The amendments have been moved and second. Are there any questions on the amendments? All right. All those in, Delegate Hill.
So, and I was in the subcommittee, but I was in and out because of other stuff. So what I'm reading here is, and I want to be clear, we did not address one of the prime issues, tell me if I'm correct, that if a sanction is imposed and there's an appeal process, the sanction is stayed until the appeal process is over, even if the appeal process takes a year or two. Did we address that at all?
Yes, that's the amendments.
It's in the amendment.
I'm reading the amendments. Can you tell me where? Because I'm not seeing it.
Yeah, let me find it.
Give her a second.
Let's see. Here, it's page 10 of the bill. So if you're looking at the packet, it doesn't have page numbers on it. So if you look at the top, it says bill page 10 of 11. Let me see if there's multiple pages that say that. But you're looking for 7-320. That bracketed C, if a person notes an appeal from an order of suspension or revocation by the board, the order is stayed. That language is bracketed. It's coming out of law.
Okay. All right. Thank you. And I also saw where we're doing, as you read, the inspections, if it's one that has things every, twice a year for 5 years. And again, just direct me to where it says, and if they're found in violation again during that 5-year period.
So for the Office of Cemetery Oversight, it's if the facility has been reprimanded within the immediately preceding 5 years. And then for the board, it's if they are under probation. So that was, the fiscal note on this bill was high.
Right.
And so this is to limit the number of inspections that are required to just sort of.
But if
add
during
accuracy.
those inspections, there's repeat violations, it's up to the board to decide whether they're going to then move on. It doesn't say if you have repeat violations, it automatically has to go. They're just going to decide.
Well, then they could take disciplinary action based on
Okay.
those violations.
Okay.
Yeah, we left it open for so they can have some flexibility.
Yeah.
We don't want to be so prescriptive, right? And since they're going to be supervised under the Department of
Much
Health.
tighter, yes.
There'll be a set of eyes, which is what this is intended to do, right? And we address the appeal and everything else, right?
Okay.
Okay,
That's what I wanted to say. Thank you.
all right. Any other questions or concerns? And we did say during the hearing, we're not going to have all the answers, right? But at least this gets us to the table, right? And giving them some resources. So we were on the amendments, right? And then we moved in second. All those in favor say aye. Aye. Any opposition on the amendments, on the bill as amended? The bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Who does not want to be on the bill? Everyone wants to be on the bill. All right. I just want to say again, thank you so much to all involved. Can you take us down a second? So, and I want to thank everyone, yes.
I think I got an idea to aid on this 1544. The medal thing.
Oh, can we do it later?
Okay.
Let's do it later because we passed out already. Thank you so much. All right. Take us down.